Guys, I have Cameron Dennis, the infamous running coach. He is amazing at what he does. He loves to run way more than I do, so I brought him on so he can talk to you guys.
Well, hi. Thank you for that lovely introduction. Yeah, I guess I would have to ask you. Maybe it's a good way that we can have sort of a back and forth kind of
Yeah,
conversation.
absolutely.
I would say in terms of the running programs that I do for people, generally, I don't like to do like a one size fits all. Because I
Hmm.
think everybody's totally different. Um, So I guess it would depend on what type of restrictions that someone would have, or
Hmm.
if there's any types of restrictions.
Right.
Let me ask you, when is it appropriate for somebody to get back, into running or get back into exercise after having a child? Is there sort of like a time frame that you normally recommend?
Yeah, so typically with a lot of women, and it's that lovely phrase we all hate to hear, it depends. It depends on birth trauma, if there was any. It depends on, was it a cesarean birth? Was it vaginal? How well is mom healing? If mom has any pain, is mom having leaking? Things of that sort. We really want to take care of those issues first. We really want to address those issues, which is why I highly recommend, not because I'm one, but because I know the benefit that comes along with seeing a pelvic health therapist after pregnancy. But we really want to address any issues that may be present, because if they persist, they can definitely hamper your running. They can delay if you've got any goals. Let's say you're a new mom and you're like, I really want to run that 10K X months out. That can really impact your ability to do so. So we really want to take care of any issues that mom may be having. That being said, the healing time is different for everybody, and I do encourage women to heal. Carried a baby for 9 months, your body went through changes. It's not going to just snap back in a day. So we do encourage healing. But typically at about 12 weeks on average, again, it depends on the woman, and sometimes that can be more arbitrary than anything else, but that can give a mom who has kind of started, working on breathing, working on positioning and posture, working on body mechanics. If a mom has started that right out the gate, she's had good nutrition and stuff like that, that's around about a decent enough time that you can say, well, let's start some strengthening to eventually progress back to running. And everybody's going to be different. If it was somebody at an elite level and not having any symptoms, maybe, but they still need to heal.
Right.
But then once they start, I usually would encourage a lot of moms, you don't just want to pick up and go run 5 miles. I'll have a lot of my moms start off with walking, even out the gate after they have a baby. Let's get you walking. Let's get
Perfect.
you walking, a mile, 2 miles, 3 miles, whatever have you. That feels good. Now, when you're walking, walk the same mileage, but pick up your pace. So walk faster. And then, if they're doing pretty well with that stuff, let's say they're not having any incontinence or whatnot, they're not having any pain. All right, let's maybe do some interval training. Do a little bit of walking, a little bit of jogging, kind of work on, and I usually do smaller time intervals, maybe do that for 10 minutes, 15 minutes, 20 minutes, but just gradually advance and then go from there.
Sure, sure. Yeah, and I would suggest that most runners are fairly casual.
Hmm.
Um, Now, and so the program for a casual runner is going to be totally different than the program for, say, competitive runner.
Yeah.
Although they might look similar in the beginning phases.
Hmm.
As you kind of mentioned, yeah, I would definitely recommend starting off with low intensity walking. And I would probably say, I would think you would probably agree. Let me know if you don't, but start off walking, even within the first week or so, the first
Yeah.
couple of weeks.
Hmm.
Doesn't mean you have to go out and walk a mile, but I think the worst thing that you can do is to sit around and do nothing, unless of course you have some sort of medical reason.
Hmm.
For say you had complications or something, and you have restrictions from the physician or the surgeons or whatever. So I would say, yeah, that's very smart. Start off walking, 10, 15, 20 minutes as tolerated, and really keep an eye on what your body's telling you. If for some reason you're having issues, like leaking or something abnormal, maybe you don't want to keep pushing forward. Maybe you want to stay sort of at that level that you're at currently, where you're walking maybe 20 minutes a day, 20 minutes every other day, until that sort of resolves. And I'm sure that you have ways, and maybe you have certain exercises that can help progress people, in that way to heal from
Yeah.
I don't know if you consider it a trauma of childbirth or not. I've heard some people say that it's not traumatic, and I've heard other people say that it is.
It depends very much on the mom and her experience, because for some people it can be. I mean, if you're laboring 24 plus hours, I call that trauma.
Yeah, and my wife, I don't think she'd mind me sharing this, but she did. It was a fairly long labor process. However, she did have the epidural, so it wasn't that it was incredibly painful for her, and she would tell you the same thing. It's just that, for maybe a week afterwards, things just weren't right, and it might have taken her probably 6 to 8 weeks for things to really start to feel normal again. However, she was up walking and things like that, even that day. So I would suggest, since everybody is so different and everyone's experience is different, that just to give like a one program for everyone would be bad advice. But to say that maybe listen to your body, so start off slow, and because you were running, 5Ks and marathons maybe before you were pregnant, or maybe even during the pregnancy. Some people run during the pregnancy. Doesn't mean that you should just start back into that. I would say I would always rather somebody take longer than needed, than to try and go back into it too quickly and maybe not, or maybe and then end up with some sort of an injury. And not even necessarily an injury related to the actual women's anatomy area itself, but an actual musculoskeletal injury to the lower limbs or something like that. That somebody would have, whether it was a childbirth, or maybe they just took off some time, or maybe they, it's hard to say. I would just suggest that a lot of people that take time off jump into it too quickly. So a smart walk to run program would be smart for most people, but especially someone who's undergone a trauma. So typically I have several walk to run programs that include strength training, because I think it's really important that people, especially someone coming off of an injury or a trauma, starts to initiate strength training. So squats, and you probably have some sort of progression.
I was actually going to ask you, what is your opinion on running, strength training complementing running? Because that was always my approach. And I know the benefits. I feel like, there are a lot of people who are natural runners, but how much better could they be if, they were stronger, especially the hips, and right. With a lot of women coming off childbirth, you've got weaker hips, you've got changes in posture. If they haven't been working out during the pregnancy, then chances are, you're going to be a lot weaker. You've got a lot of women that complain of hip adductor pain, hip flexor discomfort, adductor spasms, the obturator internus, which is a hip external rotator, can get affected by pregnancy sometimes, just because of pressures in the pelvis and different things of that sort. You might lose strength in your hip extensors, your glutes, and so on, because again of the changes that you're going through. And you look at those muscles, and those are major muscles in helping to facilitate that running, the running mechanics, and really helping you to be a strong and efficient runner. So I'm a big proponent of strengthening postpartum, even prior to starting an interval training program, in terms of a walk-run interval program for return to running, just to kind of get everything back on board.
Yeah, I absolutely agree with you on that. And usually there's sort of 4 or 5 foundational exercises that I try and get most of my runners to do. So the rehab process a lot of the times is to progress them to those exercises and get them into a regular exercise program, including these exercises. So they're going to be squats, deadlifts, lunges, calf raises, and oftentimes farmer's carries. And so those might have unique challenges for someone coming off of a pregnancy, or they might not. You know, you might know more about that than I do, as I don't see a whole lot of mothers, if I'm being quite honest with you. However, just knowing the unique challenges that these exercises and that running has on the body, anything that increases the intra-abdominal pressure, you would want to progressively challenge that area, and you wouldn't want to just go and start doing deep weighted squats.
Yeah, and then go, oh my God, I'm leaking. Really? You don't say.
Right. So how would you suggest somebody progress to doing squats, for example?
So I do butt to box, like I'll have them do it with a box, no weight. And again, it just depends on where they are, just doing like air squats, you know, so have them doing an air squat, have them start working on gradually getting lower, but coupling that with breathing. So the breath mechanics are huge. And again, talking about the intra-abdominal pressure, you know, especially for a mom, say, who's leaking, like myself after my son, you don't want to go in there breath holding and putting increased pressure on your pelvis while you're trying to do, you know, some exercise. So you really want to start training the breath, making sure that their posture in the position and with the movement is ideal, you know, so they're not flex forward, they're not leaning too far back, you know, they're not, you know, their feet are positioned correctly, because that's another thing, you know, mobility in the ankles and the feet, doing some of these exercises. But I meet them where they're at. So if you can't get, you know, to parallel, we go where you are, and our first goal is going to be, let's try to see if we can gradually get you to parallel. Let's get you to start tolerating that. And I go for quality more than I do quantity, you know, because for a lot of moms coming from pregnancy, if they haven't done anything, you know, sometimes to get to 10 could be kind of challenging. But, you know, once they get there, having them doing stretches, I love the happy baby pose where they're on their back and their legs are up, kind of like if they're in a squat, a supine squat position. I love them to go into that deep squat position and just kind of stretch the adductors out and just kind of hold that squat hold position, just so that they can start practicing getting into that deeper position, and then start progressing them down as far as they can. Once they've gotten there, then we can add weight. But, you know, I'm not going to tell you, yeah, let's go do some weight, but, you know, you're internally rotating, you know, you're shifting to one side, you know, you can't maintain your center when you're going down. Yeah, we need to do some work if we start seeing a lot of that stuff.
Right. So I guess I would say, and I'm sure you would agree, that it would probably be helpful for many, if not all, mothers to have physical therapy following a pregnancy.
Absolutely.
Because there's so many things I think that people don't realize that have changed physically after having after carrying a child, you know, carrying another human being inside of your body, it can do things, you know. So, I mean, not to mention the vaginal region, but even the abdominal musculature, which is so important for running and so important for weightlifting. So to even just get people on the right track in terms of improving their core strength after having something, you know, after having a child, I think is super important before you try and go back into sort of these higher level ballistic plyometric activities.
Yeah. And then you also have the moms that might have like a diastasis rectus abdominis. So they've got that separation. And again, like I try to remind people, it's not so much the separation. We do want to close that gap as much as we can, because, you know, if you're like 4 or 5 finger widths apart, we definitely want to get some closure, and we more than likely can. If you're still 2 and 3 finger widths apart, but you're able to generate tension, you're not doming with your activity, you're able to perform your activity and really have good control of that intra-abdominal pressure, then that's not so much a problem. And at that point, it's more cosmetic than anything. And I think that sometimes a lot of people get confused between the function and the appearance. But, you know, that's another big thing that could impact the running, you know, or the runner who's trying to get back if they've been diagnosed with that, but they've not adequately dealt with it.
Sure, that's a really good point.
Yeah. Awesome. So where can people find you if they're trying to, find a coach, they have questions regarding running, they want to start on a program, where can people reach you?
Sure. So we have the Facebook group. It's facebook.com/groups/running injury support group.
Mm-hmm.
And that's doing fantastic. We have almost 1,600 people in there in less than a year. So it's great. We have lots of resources on there, and lots of other people who are going through similar challenges,
Mm-hmm.
as well as backontracktherapy.com, where we do have one-on-one coaching, and we do have these smarter walk to run programs, which incorporate strength training.
Mm-hmm.
With that, you're in a support group, a more private support group as well, so that if you have any actual questions, any specific questions regarding your own rehab or regarding your own return to running, I should say, then I'm there for that as well.
Awesome. Well, thank you so, so much. I think that's going to be helpful for a lot of moms, because a lot of moms, they're trying to get back to fitness or some level of fitness after they've had a child. And a lot of the times for a lot of people, they just don't know how to start. They just don't know what to do and how to do it the right way so that they're not causing, stress or injury or things of that sort. So I think this is really good information for a lot of moms. So thank you so much.
Yeah, thank you very much for having me on.
Awesome.